So let's look at the first team, shall we? So first team is hers, and the team members are Linda, Yair, Hugo, and they'll be joining us on the virtual stage. They'll present their femtech solution that they've developed over the past months. Linda and Yair, the stage is yours. Welcome.
Hi, Justin. Hi,
Hello.
Justin. Can you hear us?
We
Thanks
can
a
hear you
lot.
perfectly. The stage is yours. Enjoy.
Thank you very much, Justin. We are very honored to be the first ones, and I would say we are just jumping into it.
Yeah. So I'm Yair, the CEO of Hertz. This is me 3 years ago while I was working with a gynecologist developing medical devices for pelvic floor dysfunctions. One day, my mom approached me and said, Yair, maybe now you can help me with my problem. What started as a bit of uncomfortable conversation with my mother is the beginning of hers.
Yair's mother is suffering from pelvic floor dysfunction, a problem that every second woman will experience during her lifetime. That means each one of us knows someone who's affected. Maybe your wife, your mother, your daughter, or maybe even yourself. And if you've never heard about it, it's because of the big taboo and stigma around this topic. After giving birth or in menopause, the pelvic floor is not strong enough anymore to hold the pelvic floor organs, and they will sink down. This leads to discomfort and incontinence.
The best solution for this disease is pessaries, which are silicone devices that support the organs from inside of the vagina. The problem is that while each pelvic floor is unique, they still come in standard sizes, geometrical shapes, and create stress wounds. This makes the treatment unpopular by women and doctors. And this is why we created HERS, a smart connected medical device. The biocompatible silicone goes inside of the vagina and is connected to an electrical pump for inflation. So when it's inside of the vagina, it's holding the sinking organs in the healthy position. But we don't stop there. Not like our competitors, we offer a holistic approach that stops incontinence immediately, but also offer long-term training of the pelvic muscles. So this is Sarah here, who is happy to go back to work after having her first baby. But she's in constant fear of laughing too hard or sneezing and wetting her pants in front of everybody. When Sarah applies our device in the morning, she will get the support she needs. She will get reminders to train her pelvic floor, and in the evening, she will take it out, clean it, and check her improvement in the app.
Sarah is one of 11 million women suffering from pelvic floor dysfunctions in Germany that we can address right now. We will create a whole new market by raising awareness and approaching mothers and women in menopause with a newly designed product that supports incontinence immediately. And we will take over a market share of the traditional pessaries, disposable incontinence products, and pelvic floor surgeries with a total market volume of $11 billion. And take over a share of the rising femtech market with a market potential of $50 billion. Our team is as diverse as it gets. Yair Kira is our CEO with a vast experience in leading R&D projects around the human body. Hugo Silva is our CTO, an industrial designer who founded a 3D printing company and worked in the field of medical devices for many years. Myself, I'm Linda Wannenberger, the CMO of HERS. I founded my own GmbH 4 years ago, built the first e-commerce platform for femcare products, Kuka by Linda, and also produced and sell my own patented bra, Linda Bra. On our advisory board are two well-known gynecologists, Dr. Karin Bessler, who is the author of the German guidelines for pelvic floor treatments, and Dr. Maike Henningsen, professor for digital health. Our HERS journey started in March. Alongside the awesome Vision Health Incubator, we validated our concept with a functional prototype. We built the foundation of our company with a bulletproof business plan. We're now in the final stage of the Exist application, and we're looking for a pre-seed funding of 300,000 euros.
So remember, our life began in our mother's pelvic floor. Let's take care of it afterwards. Thank you.
And thank you so much for sharing that and working on this problem. It seems really kind of like an underserved market, definitely, for sure. Now, what was this incubation program like for you?
Yeah, it was everything in the last few months. We learned so much because when we started, Hugo and me, it was 4 days before the application time that we just had to take our idea into a good application. And since then, We learned so much, both from the teams that we work with our partners, and of course from the mentors.
And do you have a patent for this?
So yeah, we're applying at the moment a patent together with a lawyer. So this will be our most valuable IP.
And when do you start? When do you plan to start commercializing the product?
So we're planning to August 22.
Yes, that's when
August
we will
22,
launch,
yeah.
because like, yeah, seeing that that our device will be a medical product, it also takes some time to develop the product, but also go through certification. So we'll launch in summer 2022.
Perfect. Now, let me see. It seems, I mean, of course, I can't try out one of these products, but it seems like a lot of work to kind of adjust it and inflate the device. How does that work? Do women have to do that every day, or how does it work?
So basically, this is exactly our USP. This is what we're want to bring to the world. So they make the all insertion of this hard silicone going to be much easier when you just press the button and the device inflate by itself. And now some women will just need it for sports or for some activities. Some will use it every day, and by that wouldn't have to go through a surgery, for example.
And that's really nice. And then it stores the settings as well, right? So you don't have to readjust it every day. Is that correct?
Yeah.
Oh, perfect. So a question from the audience. How do you face the problem of possible bacterial infection due to this device?
So it's very similar to a menstruation cup. It's also made out of silicone. So in the morning, you just apply it and you wear it the whole day. And in the evening, you just wash it, clean it, put it back into the thing that we bring along, and then you can wear it again. So it's easily cleaned. And so therefore, there will not be any infection risk.
Yeah, it's all biocompatible silicone. So it's going through all the standards and certification of a medical device.
And you showed some of the existing competitors already, right? What's your competitive analysis of the competitive landscape? What's that been?
So in general, you just have really outdated pastries. So they look something like this, and they're very stiff, and they haven't been innovated for decades, basically. And these are the only ones that you can insert and really stop incontinence. That's the direct competitors. And then we have the indirect competitors, like new femtech companies, like, for example, LV, who've just raised 30 million euros, but they're only in the training devices. So that means these devices are digital, they're also medical products, but they only train the pelvic floor, and they're not giving the immediate solution. That means you have to train for many, many months, and then maybe you can cure your incontinence, and we can say with our product, we will stop incontinence immediately. That's the big advantage that we will have.
And I'm curious, Yair, what does your mum think about this path that you've pursued now?
So I guess my mom is on the crowd, so probably we could ask her. I think she's very proud. You know, she did her job in investing in me, and now it's my time to invest in her. And it's not just her, so I think she's very happy to know that with this product, we will also can approach half of the women population in the world. So it's a big topic, and I think I'm happy that my mom was so open with me, and I encourage you to talk with your mom about it.
I will after this tonight. I will do that. You've definitely been inspiring me so far, and I think you have a wonderful product. And I want to thank you for sharing your pitch as well. Thank you so much, Team Hers.